Hello and welcome. This is Abigail Perillo from the CHESS Program Development Team. We would like to thank you for listening in on this CHESS webinar, Am I or My Loved Ones Having Flu Complications? We'd like to thank Sanofi Pasteur for making this webinar possible. Today, we will be discussing common flu complications and identifying risk factors. As well, we will deliberate what flu complications look like and when to seek medical attention for them. I will now pass the presentation off to Ms. Young.
Hi, my name's Corinne Young. I'm a nurse practitioner working in pulmonary critical care and sleep medicine for the past 15 years. And today I'll be talking to you about complications related to the flu. So when we think of the flu, we think of the common symptoms of headaches and body aches and fevers, sometimes even sore throat. But unfortunately, some people could go on to develop more severe symptoms and complications related to the flu. These complications could include pneumonia, which unfortunately can be very devastating and cause respiratory failure. They can develop sinus and ear infections that can be very uncomfortable and work and life prohibiting in your symptom control. Inflammation around their heart can be very serious. It's called myocarditis. They can have inflammation around the brain develop, which is called encephalitis, or even swelling or inflammatory changes within their large muscles, which is called myositis, or a very severe condition called rhabdomyolysis. Multi-organ failure is also a complication. Patients can go into renal failure, not just respiratory failure. They can have a systemic or a diffuse spread of infection called sepsis. And unfortunately, the biggest concern is death related to flu. In the United States, unfortunately, we average around 20 to 50,000 deaths related to flu virus. So when we think of who's at the biggest risk of developing these complications, children are always at the top of the risk profile, unfortunately, and then adults with chronic health conditions, specific respiratory diseases like asthma or COPD. Unfortunately, these patients are already at a high risk for respiratory complications and respiratory failure, and a lot of them cannot manage the flu virus very well. And if they were to develop pneumonia, these patients most certainly, unfortunately, become hospitalized and often need to be put on a ventilator. Children under the age of 5, and specifically children under the age of 2, unfortunately carry some of the highest mortality when it comes to children exposed to the flu. And it's because they develop these complications of pneumonia or sepsis or multi-organ failure. Adults over the age of 65 and older, we always worry about older immune systems and their ability to fight off infections. And of course, when they develop the flu, we worry about it progressing into these complications like pneumonia. And pregnant women, of course, we are always very concerned about as they are at risk. So how to know if you're developing a complication? Well, with the flu, again, we expect general malaise, not feeling well, having a headache, having body aches, having fevers, generally not feeling very well. However, you shouldn't have trouble breathing. So if your breathing has become very rapid, very, very shallow, you're not able to catch your breath even at rest. That's a very concerning symptom that you would want to be seen for right away, and not something you'd want to make an appointment for to see, but maybe go to an urgent care or ER if you are having trouble breathing. Some patients, if they don't even feel like they can make it to the ER, we want you to call 911. Chest pain is also not a very common symptom for basic flu virus, but if it's developing into something more serious, like that swelling around the heart we talked about, or into pneumonia, that you could develop chest pain. So that may be a hallmark symptom that you're developing a complication. Seizures are not common, but unfortunately with high fevers, some patients do have a low seizure threshold and can develop seizures with high fevers. If you're developing seizures, absolutely that's something that needs to be addressed in the emergency room. Severe weakness, muscle pain that interferes with your ability to walk, or steadiness. If patients start falling because of muscle weakness or pain, that's more concerning for the muscle inflammation we talked about, the rhabdomyolysis or myositis that can happen related to the flu virus. Children with fever above 104 that cannot be controlled with NSAIDs or those types of therapies, we do want to get that addressed if it cannot be brought down. Children less than 12 weeks of old should not ever develop a fever. So if they're developing fever, there's flu in the family, or we suspect the child is flu positive, any kind of fever is very concerning for children that young. Their immune system is not yet fully developed. And if they're ill enough to develop a fever, then we really are concerned how ill they really are. If a patient has a chronic health condition, such as asthma, COPD, diabetes, those types of things, and they develop the flu, but now their underlying chronic condition is now worsening. They're wheezing with their asthma is not well controlled. They're needing their rescue inhaler more. Patients maybe with COPD or emphysema who are on normally maybe 1 to 2 liters of oxygen now have to be on 5 or 6 liters of oxygen. That sign of worsening is very concerning and also, again, needs immediate medical attention. In most patients, the flu should only last for a few days to maybe 2 weeks. It really shouldn't be lasting any longer than that. And if patients are having symptoms lasting longer than 2 weeks, then the symptoms they may be having may be the complications that have developed because of the flu virus. So again, if you're ill past 2 weeks or your loved one is ill past 2 weeks after being diagnosed with the flu, they definitely need to seek medical care. Rare complications of the flu are related to things like pneumonia. This is our biggest issue, and I would say most common complication related to the flu virus. And again, these patients may require life supportive measures. These patients can go into acute respiratory failure and require support with oxygen, and sometimes may proceed into requiring support from a ventilator to help them with breathing. Persons who develop the rhabdomyolysis, that's swelling or inflammation, damage to their large muscles, may develop kidney failure related to it. And unfortunately, if their kidney failure is severe enough, they will then require dialysis. So this is a very big complication. Also, they can end up with some permanent damage to their lungs that's lifelong. So, if they do develop pneumonia and develop a very severe case, there are some who develop acute respiratory distress syndrome and failure. They end up on ventilators. And unfortunately, they can have such inflammatory changes inside their lungs that they're left with permanent scarring. If this happens, then unfortunately, they could require long term oxygen support. Um, Lifelong, even after the flu is gone. They just unfortunately now have damaged lungs and they won't function normally again. So these complications related to the flu are not often talked about, but we definitely want to review to bring information to you of what to look for in case it's not the typical flu virus.
All right, well, thank you so much, Ms. Young, for a great presentation, and thank you everyone who attended the webinar.